Hey, everybody. Welcome. This is going to be a fun little talk to have here. First of all, I'm Dr. David Haase at MaxWell Clinic. And tonight we're going to talk about what is integrative functional medicine. And I may even retitle this like, what is MaxWell Medicine, right? And we'll kind of go through and I want to give you an opportunity to think through your own health and your own way of understanding your health, how you uniquely can create more of it, and what are the particular challenges that you have. I'd love to. I want to invite any questions at all because this is a we have to keep anonymity because we want to make sure that everybody is we're keeping everybody privacy recognized. But I love questions and I love the interaction that happens. And this is a super important question because it's not just for this idea of, okay, I mean, it actually annoys me that there are so many brands of medicine that are out there. There's so many like labels for this and for that, because sometimes it clouds the very needs that the patient has, which is to thrive. And each person, as they are engaging in their mystery of how they live their best life, how they create health the most for themselves, they're trying to find, you are trying to find your answer. I am trying to find my answer. And so we have to learn from other people and that's what labels and brands and things like that are good for. But I thought it would be really useful as we go into this question about, because I think the real question is, what is good medicine for you, right? And that may or may not be integrative functional medicine. So let me tell you where this started for me. You may see behind me, I have a whole bunch of fun little things up on my wall. On the very top is Vanderbilt University. So we went to medical school, and there I was asked a really important question that really changed the trajectory of my life. And it was asked to me by Dr. Dean German, who is the Dean of Student Life at that time at Vanderbilt University. And Dr. Debbie German was just amazing as a teacher, as a leader in thought of healthcare. Matter of fact, she was then asked to start her own medical school in Orlando, Florida, and has really led the way and created an entirely really revolutionary way of medical education. So an incredible soul. And at one of the first days of medical school, we have this thing called the white coat ceremony, where they hand out our first white coat as this initiation from not being inside of the world of medicine and physicians to entering into that world. We were given a white coat, and it was a very auspicious day, right? But during the ceremony, she asked a really important question. And she went in front and she wrote on the board in big letters, "What is the good doctor?" I mean, I'd ask you right now, like, what if I were going to ask you that question, how would you answer the question? What is the good doctor? You feel free to put comments in the Q&A if you like. And a whole bunch of different words started to spew out of the crowd. It was like, okay, intelligent and caring and compassionate and hardworking and honest um, and bold and knowledgeable and oh my God, the board just filled up with these words that after you look at them for a while, you're going like, okay, I am hosed. Because I mean, there's only one Clark Kent, and there's only one Superman. So how do you do all these things? How is one the good doctor? And she ended that little phrase in saying, well, that's a question for you. What is it for you to be the good doctor, right? And that it really stuck with me. And it was like, And it started, I wrote a book called Curiosity Heals the Human. The subtitle is using um, solving unsolvable problems with better questions and advanced technology. So this idea of how do we have a better question has always been way more useful, I think, than necessarily how do we have a better answer. Because if we have a really good question, it's going to lead us to so much more than just one good answer. It's going to lead us to a host of good answers and probably a bunch more good questions that are lead us closer and closer to truth. So this quest for what is the good doctor started to shift for me into, well, what is good medicine, right? What is good medicine? And and that a big epiphany happened while I was at Mayo, or where I went, oh, wait a second. I'm so glad I'm here at Mayo Clinic and I'm getting to be trained by the world's best physicians, and I'm learning how to diagnose and treat disease because that's what my medical license gives me the privilege to do. That is the practice of medicine, is to diagnose and treat. And it's a very important and challenging thing to do. And I take great respect in that. And yet there's more, because it's not just diagnosing and treating disease, but it's also asking the questions, how do we create health? And once we start asking that and recognizing that, wow, our body is designed to heal, our body has this amazing capacity to regenerate. And we can be assaulted by bacteria and we can respond without destroying the body. We can, uh, when we break a bone, we know how to knit it back together. When we're challenged with various adversities, our body gets stronger and more capable as a result of it. It's really amazing. And that fascination with why, uh, you know, how does health work? And so it started me on a quest of, well, how do I find mentors? I mean, that's really all the way back to Hippocrates. The Hippocratic Oath has a large part of it saying that I will respect those who teach me, because the medicine is both an art and a science. And so we seek out teachers in both of those sides of medicine. And so I first came along a group of doctors that called them holistic. There's a Holistic Medical Association of America. And they're a beautiful group of people that it kind of came back from kind of the hippie crew that said, hey, man, it's all good. Let's do some herbs, put on a poultice. It was a fun group of people to hang around, actually. But they weren't really interested in the science, right? It was more, hey, this is what my grandmother taught me, and this is what we should do. And it had some pattern recognition, and that was really important. But I love science. I love asking good questions and digging deeper. And so I found my way to this early group of humans that were creating the Institute for Functional Medicine. And functional medicine was a new way of thinking. It was basically applied systems medicine. And so to answer the question, what is integrative functional medicine? I need to help you understand how these things came to be, because the functional medicine was founded by a biochemist, a PhD biochemist. And you can know a lot about an organization by understanding its founder. And so, as a PhD biochemist, he was very interested in all these metabolic pathways. And okay, if you put in these molecules into the body and interacts with these genes, then you get these effects. And there's biological individuality in every person. And oftentimes that biological individuality is what we need to understand in order to help a person go from a state of dysfunction to high function. And functional medicine started to recognize that, wow, if you've been to our clinic, then you've seen the wallpaper on the front in the lobby, which is a map of metabolism, or actually it's just a very small part of metabolism, but I made sure to include the Krebs cycle because I'm particularly nerdy about that little part. But in metabolism, it's this big map. So this is connected to that. This is connected to that. It's all connected. That's a very important fundamental understanding of functional medicine, that it's all connected. All of biochemistry is connected. All of your physical structure is connected to each other. You know, if you have a bum knee, that's going to put extra stress on one part of your hip, which will put stress on your back, which may give you a headache. You know, the leg bone's connected to the hip bone, that kind of thing. And it's also, we're all connected when it comes to our relationships. You know, we exist not alone, but we exist in the context of our world. So functional medicine is very interested in how are you connected with your world, and what exactly kind of function do you need in order for you to thrive? You know, not everybody needs the same health, right? Some of us, you know, are really need a health of the mind so we can, you know, ask different questions and solve bigger puzzles. Some of us need a health of the body more. Some need a health of the spirit. I mean, there's for each aspect, for each calling, for each one of us in our particular station in life, we may need a different kind of health, and that, but all those forms are still connected. Functional medicine was always very centered on the individual. It's a very individualized medicine, rather than saying, oh, you know, lumping all people with diabetes into one big junk and lump and saying, oh, you are diabetics. That's now your identity. Instead, functional medicine is, oh, you are a person that has diabetes, and that personhood, you know, and the life history and your genetics and all your exposures that brought you to this point is what caused you to now make apply the definition of diabetes. And because once you think of disease really as the end state of a process of dysfunction, then you go like, ooh, there's a process here. There's a process. Disease just didn't fall out of the sky and hit me on the head, right? I mean, this is kind of common sense, actually. Once, and my patients never argue when we discuss these things, because yeah, there's obviously reasons why I got where I am. Some of them may be discoverable. Some of them maybe not. Some of them I may be able to do something about. Some I can't. They're in the past. But as long as there's a process of how disease and dysfunction is created, we can be curious. And that's the other part of functional medicine, is very focused on finding and addressing the underlying causes of dysfunction that then lead to disease, disintegration, degeneration, disability, and death. So function is first. And um, functional medicine is also biased towards natural therapies. The nutritional biochemist that started the Institute for Functional Medicine was a nutritional biochemist. And so food played a very big role in this whole realm. And then supplements are essentially concentrated foods. And so if a food can be helpful, it's possible that a concentrated food, you know, could be helpful in an individual. And if you're really thinking coming from a baseline of biochemistry, um, you know, you can't really look at a person and say, oh, you know, you're your CoQ10 is low, or your subarate to malate ratio is abnormal, or you know, you can't make molecular diagnoses with the naked eye. So functional medicine began to really embrace the science of measurement. How do we measure metabolism? How do we measure hormones? How do we test, not guess? And how can we apply that thinking to make better understanding the person, the individual? So, so functional medicine really felt like home for me. I was like, wow, this is great. We have all this knowledge about underlying cause. We can do testing to look for these causes, and we can do something about them. We can add in things that are good. We can apply strategies to remove toxins, infections, allergens, injuries that are bad. And that really is kind of the sum total of functional medicine, a patient-centered, individualized, root cause, systems medicine approach to improving function at the level of the molecule and the cell and the organ and the whole person. That's functional medicine. Now, we kind of continue on, and I then learned it like, wow, we found a lot of answers, right? We found a lot of answers about what could be done. And I became very interested in behavior. And so this pulled me back towards what now holistic medicine had converted into integrative medicine and the field of health coaching. And I went, oh, wow. So that got me back into that organization. And I think up here somewhere, yep, over here, this is my board certification. It is a U.S. medical specialty of integrative medicine. And I'm board certified in the first class of that. And we went, well, that's really good. Well, what is integrative medicine? So integrative is really, you think of it in the conventional medical world, having not really, and they're looking to say, hey, there must be more here. We need to integrate other therapies into drugs and surgery. We need to integrate behavioral change. We need to integrate lifestyle change. We need to integrate yoga, maybe integrate acupuncture, integrate mindful meditation. And we need to recognize this is a whole person that we're dealing with and bring in a mindset of a whole person interacting with a whole person. Now you can see a lot of similarities between these two descriptions, can't you? But integrative medicine made better inroads into the conventional medical world, and there's many departments of integrative medicine across the United States. There are more functional medicine facilities in larger medical institutions now as well. And so but if you put these together, you're really looking at, okay, let's focus upstream as we can for an individual. Let's try to find the underlying causes of dysfunction for this person that are leading to their degeneration disease. Let's approach them as a whole person. Let's use any tool that is going to be maximally safe and effective for that particular person. I have a real bias. I like to say, first do least harm. Now, you've heard it maybe said, first do no harm, but that means you don't do anything. Because if we're honest, even breathing has risk of harm. So I like to say, I like to be honest, and first do least harm is what we should do. So whenever we're going to pick what kind of a therapy or what kind of a change we need to do for a person, we should exhaust all of the therapies that has a lower potential for harm before we move on to therapies that have a higher potential for harm. I mean, it really makes sense, right? But we don't tend to think that way. And so if we take this integrative functional approach, we start to have an opportunity to be person-centered, cause-focused, being curious, applying advanced testing, first doing least harm, recognizing that every person has a different desire for their health, has a different goal for their health, and has a different way, different needs in order to create that health that they desire. So both in integrative functional medicine, relationship is a very important part. It starts with a conversation. It starts not with, just checking a few boxes and being labeled as something, but it really starts with being understood. And then it is a clinician-patient partnership. It is an opportunity to walk together through these challenges. And health is not created overnight. You're kind of looking for the magic pill. Hey, there are some wonderful therapies. There's some great things that can be helpful, but health has to be created over time. It is walking together, and I always trying to train our clinicians. I love teaching, and we do a lot of collaboration amongst all of the clinicians that are here about what is the next best step. What is the the thing that's most likely, or the group of things that are most likely together to create the most positive benefit for this individual and with the least likelihood of harm, with the wisest use of that individual's resources. Because it's undeniable, in order to get something, you have to give something. You have to give time, focus, energy, effort, money, relationships. There's all kinds of resources that we have that we're going to need to harness if we're going to create something new in this life. So that clinician-patient partnership is an incredibly important aspect of this. So I hope you're getting an understanding of how this idea of what is good medicine, we at MaxWell Clinic are answering in this major MaxWell Care component of our practice with an integrative functional approach to your care. Now, it's really interesting, though, that doesn't mean that's all that's there. I mean, we prescribe medications when are necessary. I mean, I'm really thankful for every tool under the sun that exists. I think medication, surgery, whatever happens to be the best solution for that individual is what we should be doing in that particular case. And there are other components. One is really a preventive medicine. So oftentimes preventive medicine is more testing the individual for early disease, like colon cancer screening, looking for coronary calcium scoring. We have blood tests that are help for the early detection of cancer. We have EEGs that look at brain function and neurocognitive testing that can see is brain performance slipping even before the individual knows that's going on. If we can find early dysfunction, wow, do we have an opportunity to change the trajectory of that person's health? So that, if we think that is really kind of a preventive, and if we're getting a little more serious about that, it's a proactive approach. How do we really screen for not just disease, but how do we screen for dysfunction? Where you not have optimal nutrient status, where you have increased evidence of inflammation, where might you have a insufficient amount of hormones present, where might you have an excess burden of infectious compounds or dysbiosis in the GI tract. So we can be proactive to say, hey, I don't want to wait till disease is there. I want to find and address the causes of my dysfunction proactively. And that too is part of our approach on an individualized basis, according to what a patient needs and according to what a patient desires. So there's other components that we do here. We're really a world leader in regenerative medicine. So regenerative medicine is how do you help tissue repair? And you've probably heard me talk about therapeutic plasma exchange. And this is a technique that cleans the blood, removes the clutter that's in the blood, and allows the body's signals of health to make your own stem cells apparently behave younger and improve the capacity for repair. In the AMBAR trial, looking at therapeutic plasma exchange as a treatment of Alzheimer's disease, we actually saw a dramatic slowing in the progression of individuals with advanced Alzheimer's disease and an improvement in individuals with early Alzheimer's disease. This is really exciting, and we're doing a lot of research and treating patients that have cognitive decline. We're very proud of those results, and we're going to be talking more about them. I'm going to put one more plug in here for clinical research. If you please go to our website at maxwellclinic.com and take a look at, there's an area there for research. Please look and see if there's any studies that apply to you, because then you are also part of the solution. We're wanting very much to both find the finer points of what works best in the world, and then at the same time, um, teach other clinicians and change healthcare overall. So let's go back to what is good medicine again, and think about performance medicine. So sometimes when we're thinking about function, we're also thinking about how do we perform at our highest level. And that has a great way to think about that would be the work we do with neurofeedback. Because we're trying to, we actually can do a map of the electricity of the brain, and then you train an individual to have more efficient brain waves. That brainwave pattern has the capacity then to improve mood, attention, um, memory, the ability to study, address learning disorders, address challenges on the spectrum, individuals with autism or Asperger's disorder. And that is all by approaching the brain from a functional perspective. There's also a deep aspect of nutritional medicine in what we do. Because you have about 30 tons of food that come through your mouth, through your whole gullet during your lifetime. And that 30 tons of food becomes the sum total of who you are. It's very important to always focus on eating good, clean food that's low in toxins, it's high in nutrient value. And that is, again, part of this integrative functional approach. And a lot of people ask, well, what are what we do in the research arm in our deep dive program, or we're really going to the next level of these things. Your engagement with this proactive medicine approach, this integrative and functional approach, is going to be as individualized as you are. Some individuals are committed at a level and are going to put the level of resources towards something to build around them all of the team that's necessary, that has the years and years of expertise, the complex tools that are there, and the time that's necessary to go into all of these things. And so all of our ability to get to the bottom of the bottom of the bottom is dependent upon these characteristics. What's your team? What's their expertise? What is their experience? How much time do you have to do that? How many resources do you have to go towards that? And so it is beautiful medicine, but it's always a conversation. It's always a conversation about, all right, together, let's decide, where do you want to go with this? Some of our patients want to investigate everything at one time. And I kind of joke about that. I mean, MaxWell Clinic is very different from other functional medicine clinics that you may see. If you see functional medicine online, their philosophy may be much the same, but they don't have the years and years of accumulated information among the clinicians. But even more than that, the resources here to do testing, we are able to use laboratories from over 50 labs from across the world. We have many different therapies, IV therapies, neurofeedback, regenerative musculoskeletal medicine for joint problems and joint pain. And it's because sometimes functional medicine can be done online with like a telemedicine visit. And that can do incredible good for some people. But having a in-person experience and having all of our team present in one space to help an individual can be really beneficial for many. So I think it's important to, as we think of this integrative and functional medicine approach, to step back a moment. Now that I've talked about these things, what do you want your health for? Have you asked yourself that? I'd love, again, if there's anything coming up for any of you, please put questions in the chat, ideas. But I want you to ponder this. What do you want your health for? Are you a grandmother that wants to impart your wisdom into your grandchildren? Are you a business person that needs to have a sharp mind in order to stay ahead of the competition that's coming up behind you super fast? Are you an individual that is just suffering from pain at a level that it's removing you from being available to your family and to contribute in your world as you want to do? At the end of the day, we get to go around one time, right? Death is going to get us all. And how the quality of our life, literally the quality of our days, is what we're here to help improve. And the more clear that you are about what you want your health for, the better off you're going to be able to find the resources that are necessary for that. There's many clinicians, there's many different ways of approaching healthcare. But if you're really clear upon what you want, you're going to have the internal energy, the discipline, the drive to find a partner clinician, to find a partner clinic so that you can overcome your particular challenges. You have immense power inside. I get to see it all the time. Each of us has the ability to heal, and it's up to us to maybe exercise some humility, maybe get over some denial, maybe exercise some curiosity, maybe say, yeah, I am worth it. I'm going to invest in my own well-being, because if I don't have my health, I really don't have anything. There's an old saying that the man who has his health has 1,000 dreams. The person who does not have his health has only one dream. A good question here. Okay, have I worked with mild cognitive impairment? Oh, yes. Matter of fact, it's a big emphasis of our entire practice. Is it something that can be slowed or reversed? Well, let me tell you this. So we have a patient who actually had the diagnosis of dementia, 91-year-old in a nursing home. And last month, we got to discharge him back to assisted living. He was doing so well. That was through a combination of our systems medicine approach and therapeutic plasma exchange, and a family who was really committed to helping that individual eat well and engage in physical activity. And even at 91, here's an individual who got a substantial amount of his hearing back, a substantial amount of his sight back, his muscle mass, and is just a delight of a human being to all that know him. And to see his sense of humor coming back and his good mood. And that was an incredible experience. But let's talk about what mild cognitive impairment is a little bit, okay? So mild cognitive impairment is when you're not yet in the dementia category, where you're lost so much function you can't care for yourself in some meaningful ways. That's really what dementia is. And you're not normal, okay? You're not at your normal best. Mild cognitive impairment first starts usually as a subjective cognitive impairment. It's like yourself going like, I can't remember the name of that person easily. I can't, I don't know who, I can't do my checkbook as easily as I used to. Oh, where are my keys? I'm losing my keys all the time now. I never used to lose my keys. Not being able to find the words that you want to say at a given time. All of that can be a subjective cognitive impairment that nobody on the outside can know yet. Now, with our cognitive testing, we may be able to help see that, yep, definitely you're lower than we would expect given your state. And that is the best time to start engaging. Matter of fact, it'd be better to do proactive testing and see what are all the factors that could set you up for a cognitive decline, even if it's mild cognitive decline. But we always start where we are. Now, subjective mild cognitive impairment now starts to become objective mild cognitive impairment, or um, a more advanced form of that, where other people are noticing that you're having memory challenges, you're having um, focus issues, you're having individual problems with finding the right word or putting together complex information, but you're still able to care for yourself. You're still driving, you're still working. It's just hard. It's just hard. And more people are having to cover for you, and you're having to cover for yourself, and you're having more anxiety and depression around this, and being a huge loss of quality of life happens in this zone of mild cognitive impairment. I want to really encourage you, seek evaluation. We actually do, we have a very special program, which is our brain health evaluation program, our cognitive health evaluation program. Come in, get a bunch of tests done, and have a single visit with a clinician that shows you all your results and talks to you about, this is where you are, this is what you can look at, here are your options of what you can then do from there, either for further evaluation or uh, what next steps may you want to take. I think we built that program especially for people who want to know more about their cognitive function and then what their options are to go on from there. Um, and then mild cognitive impairment, once it crosses this threshold of impairing your ability to function independently, we now call that dementia. And it can have many different forms, but that's the general pattern. Always best to address a problem earlier than later. Um, and yeah, that's good. Okay, another question. Hey, doctor, how do you feel about plasmapheresis versus donating plasma at a free donation center? Great question. Wonderful. Well, this has been looked at. And so plasmapheresis, when you're having our HOPE procedure, which is habitat optimized plasma exchange, you are having approximately 3.5 to 4 liters of plasma removed from you. You're really cleaning out the body of plasma, and then that plasma is getting replaced with a clean pharmaceutical plasma replacement fluid called albumin. And so the main way we believe plasma exchange works is by changing cellular signaling. Now, well, you can understand cellular signaling kind of like I'm talking to you right now. Or imagine you and I were sitting in an auditorium, maybe a high school basketball auditorium, right? And and man, the opposing teams are going nuts. The fans are going crazy. Everybody's loud. The band is playing. There is a lot of signal going on, right? There's a lot of signal. And I want to turn to you, and maybe you're a row away, and I want to tell you something. I'm going to have to yell. I'm going to have to really yell. It's going to be hard for you to hear me because there's so much noise going on. My signal doesn't get through very well. Take it instead, imagine emptying out that entire auditorium and it's quiet as a mouse. You could be sitting on the other bleachers on the other side, and I could speak in a normal voice, and that signal would travel just crystal clear because there was no noise present. That's kind of what's happening in your blood when we're going through life. There are lots and lots of signals of telling the cells to either grow, to shrink, to act like a zombie. Those are called senescent cells. So we actually have senescent signaling molecules. We have oxidized molecules. We have autoimmune antibodies. We have um, mRNA signaling patterns. So all of that is just a lot of noise. And when we do plasma exchange, we are decreasing the level of that noise tremendously. And it turns out that the stem cells that live in all of your tissue everywhere, in your skin, in your heart, in your brain, your nerves, all those stem cells, if they're in a clean environment, they behave younger. And we've now been able to show this through some very advanced testing called transcriptomics. And it's undeniable that plasma exchange dramatically changes the behavior of the cells by cleaning out the junk, taking out the clutter, removing the noise, so the signal can be heard. Now, I went through all of that to explain that. So if you go and donate plasma, which is a wonderful thing to do, and I encourage people to do it, there may be some benefit, but you can kind of think of it in that auditorium setting that instead of clearing out the auditorium of everybody, you decrease the crowd by maybe 1/7. You take out 1/7 of the crowd, and that's how much the noise goes down. It's not really enough, it turns out. It's not enough noise going down to change how the people are able to have healthy signals as they're having a discussion. And it doesn't appear that just donating plasma gives that opportunity of signal or of noise reduction that is necessary to do the types of trigger the types of regeneration that we see with a plasma exchange. Even if you did, you know, if you had 1/7 of the amount of plasma removed in a plasma donation, if you did that 7 times, it would just be going to 7 different games and having the, like 1/7 of the crowd be quiet, as opposed to having the entire auditorium quieted. But I hope that helps understand. So I really want to encourage people to donate plasma. It's a very good thing for your fellow man. The albumin that we use as the replacement fluid has actually been processed from plasma. It's been highly cleaned, and any type of infections or toxins or any other proteins have been removed. It's a very pure product. And that's actually how we are able to get our albumin to do our plasma exchange, which is very important. I think it's going to be a very important part of what happens in longevity healthcare moving forward. So I hope that answers your question a little bit more. So now we got to plasma exchange through this integrative functional mindset, right? We got to plasma exchange by saying, what are the underlying causes of health? And what are the underlying causes of disease? How can I systematically remove the negative causes and add in the positive causes? And honestly, it has given me such joy to see that if we just clean up our plasma, the body knows how to create health. So how are some ways you can clean up your plasma right now? Well, eating clean food, recognizing what foods work with your body and don't work with your body. That will make decreased inflammatory signaling in your body. Doing some intermittent fasting. Intermittent fasting often causes something called apoptosis to occur, and that's where some of these zombie cells, instead of just sitting there and festering and kind of letting loose of a lot of molecules that irritate all of their cellular neighbors, they instead decide, okay, it's time for me to go and die on their own, kind of like a leaf falling from the tree, and that's good. Those should just either thrive or die. That's a good thing, good choice as a cell. Don't live in the middle as a zombie. And so yeah, that would be a way. So everything that we're doing is coming out of this person-centered, multiple causation, upstream centered approach to how to practice good medicine. So we haven't had any more questions on that. I hope this has been helpful to understand. This is really what we think of as MaxWell Medicine, and each of us are going to continue growing as clinicians. The clinicians that have been drawn to work here, amazing individuals that each have some of their own unique capacities. They're all growing. We hope not to be the same clinicians next year that we are this year. If your clinician isn't growing, you're probably missing out on what's happening in the world, because there's so many new opportunities to accelerate healing. So if you're looking to grow, make sure you're partnering with somebody else that wants to grow as well. Oh, and great. So thank you for the well wishes and the comments. I I love this time, and I hope that it's encouraging to you to recognize that you are the one that creates your health, and that you have a huge capacity for healing inside of you. If you're feeling discouraged, just consider what happens if you get a little cut on your hand, and how many millions and millions of cells get created from your stem cells that live inside your tissue. New blood vessels, new collagen is laid down, new even nerves that are cut will mend themselves and put their ends back together, or grow or extend out through that injury. Um, it's really amazing. And be curious about how you can create more health for yourself. So anyway, I wish you well. Hope this is of use to you. Much love. Dr. David Haase signing off.